Welcome to another episode of the Federal Newswire's Business of America podcast with your host, Jerry Rogers.
Welcome to another episode of the Business of America. I'm your host, Jerry Rogers. And with us today is a very good friend, someone who I've known, I guess I'm aging myself here, but for 2 decades maybe. He was an associate director of public affairs at FDA, founder, president of the CMPI, the Center for Medicine in the Public Interest, someone who is an honest actor when it comes to health policy, science, and the business of healthcare. And so I'm so pleased to have Peter Pitts with us, joining us on the Business of America. Peter, hey, welcome.
My pleasure, Jerry. And by the way, you are aging yourself, which is okay as long as you don't age me.
Well, you look at you. You look great. And by the way, I go by that old Saturday Night Live skit, Billy Crystal. It's better to look good than to feel good. So anyway, we both look good. Let's tell us a little bit before we start. Tell us a little bit about your background, your work at FDA, and then of course the Center for Medicine in the Public Interest. And also, I know that you're a professor as well. Give us some background.
Well, thanks, Jerry. As you said, I was an associate commissioner at FDA with a lot of things under my portfolio. One of the more important ones being the public spokesperson of the FDA in charge of the public affairs office. So I understand when the FDA does things right by communications and when they do things wrong. So there's a lot of issues in terms of what the FDA hasn't done right lately that needs to be floated up there so they can apologize and move forward. I started and I run still the Center for Medicine in the Public Interest, which is a not-for-profit agency really in place to talk about medical innovation and to tell the truth. And sometimes that truth is not pretty. And I'm a visiting professor at the University of Paris School of Medicine, which gets me over to Europe often. It's good eating. And it's also interesting to see how Europe is dealing with many of these same issues in ways that are better than we are and in ways that are worse off than we are, specifically in terms of the way they help to address innovation. So when people say we should do things like they do in Europe, they really should know what they're talking about. Because sometimes the way they do it in Europe is far worse than the way we approach it here.
Well, let's talk about that innovation for a minute or two. America is blessed because the innovative biopharma community is here. I mean, look, there's great companies and innovation and science happening around the world, but America is really blessed with this sector. And it strikes me as funny, it always has been, that the biopharma sector, which gave us Operation Warp Speed and a vaccine to market in miraculous time, but also all these new medicines and cures and therapies and biologics. Again, we're looking at curing diseases that haven't even presented themselves yet. It really is the golden goose of American business, American innovation. But it seems often that they are a target. Why? Why is big pharma a target by politicians, late night comedians? They seem to have a target on their back.
Well, I guess there's a quick answer, and then there's the backup. And the quick answer is it's politically convenient to look for simple answers to complex questions. The truth is that things don't happen by accident, and the reason that innovations in healthcare technologies, the reason that they almost exclusively come from within our borders, is because we like innovation. We believe in intellectual property. We incentivize it, and you get what you incentivize. And there's nothing more clear cut than when you look at the Orphan Drug Act, for example. We just passed the 40-year mark of the Orphan Drug Act, where we incentivized investment in hard to cure, very hard to address diseases. And since the Orphan Drug Act came online 40 years ago, we have over 800 new FDA-approved treatments for disease cases that never had any treatments at all, none. Wow. Europe doesn't do that quite as aggressively as we do. The reason that real medical innovation comes from the U.S. is because we incentivize it. We believe in the free market. We believe that when you free geniuses up to do their jobs and you reward them fairly, you get miraculous cures. So that's not rocket science. But people want to point to Europe and say, well, why are drugs so much less expensive there? And again, the truth there is, in the U.S., 80%, I think probably these days, closer to 90% of all medicines used by volume are generic drugs, right? Safe and effective, FDA-approved generic drugs. Generic drugs in the
Sure.
U.S. are less expensive than Europe and Canada, but somehow nobody wants to talk about that. These new miraculous on-patent medicines are more available to patients in the U.S. than they are anywhere else in the world. Again, this is not an accident. This is because we believe in it, we incentivize it, and it happens. So when you hear the president talking about wanting to march in on drugs because they're too expensive, that's a political talking point, and it punishes patients. So when you put politics over good public health, you're heading in the wrong direction.
Let me ask you this, because the president did say that, and he lamented that 25 companies control 70% of the medicine, the drug marketplace. But I did a little Jerry Rogers math, and that's less than 3% each. And so, I mean, that it seems that they're looking for reasons to. And again, this is both Republicans and Democrats. I mean, I'm old enough to remember where Republicans were talking about importing price-controlled medicines from Europe and from Canada, and some conservatives as well. Calling it the free market because it's free trade, and not understanding the dynamics of price controls and compulsory licensing. But my point is that it seems that politicians, but also the media and various political advocates, look to create a boogeyman. They're the bad guys. You're sick because of them, or your life is a mess because of them. And I say that to set up this question. This is not something that has to continue. We can create a circumstance where American innovators can't do their best and not bring new medicines and therapies and therapeutics in the rest of the market. Is there? I mean, what does the future look like in terms of medical progress?
Well, if you want to say, listen, here's what we're going to do. We're going to mess around with intellectual property. We're going to mess around with the patent system. We're going to aggressively seize people's intellectual property and their patents. But the side effect of that is, from this moment forward, there will be no more medical innovation. All the innovation we've got, that's it, no more. And that's clearly unacceptable. And any politician that said that would be laughed out of office. The truth is that when you talk to people about drug prices, and when the president says, the IRA is going to lower drug prices, you need to dig a little bit deeper, because when you pick up the newspaper and you hear about, I'm aging myself too, how many people even do that anymore? But when you read about a new drug and that the list price is, pick a number, $1 million, that's a meaningless number, because patients don't pay the list price. Patients pay their copay. And over 92% of Americans have insurance that picks up those costs. All these various policies about impacting drug development, who developed what, and price issues. So that's like $1 million for talking points, not 1 cent for copay relief. The IRA or the new patent Bayh-Dole Marchin initiative that the administration is talking about will not lower a patient's copay by a penny. It's dishonest. All these initiatives aren't going to lower drug prices for patients, because when patients say my drugs are too expensive, what they mean is my copay is too expensive.
Right.
That's just a fact. And none of these initiatives lower copays by a single penny. But what they do, as you mentioned, is they really threaten the initiatives to invest billions of dollars in healthcare technology, drug development. And most drugs that are initiated by drug companies fail. The failure rate, even once drugs are inside the FDA, is enormous. The FDA does not approve drugs willy-nilly. Most drugs fail. So unless we give drug developers, the innovative industry, the sign that we're going to support their efforts through fair reimbursement policies, adios innovation, and we end up being just like Europe, which is not where we want to go. So again, the talking points are one thing. The reality is something very different.
And I like what you said when we started the program. You talked about how, what CMPI does. Speak the truth. We don't have to be partisan about this. In fact, there's nothing partisan or even political about folks wanting universal care, coverage, access to care. But it seems to me that the politicians very often create circumstances where they have to ration access. And again, because this is a complicated question, many folks don't understand it. But you also mentioned the Inflation Reduction Act. I was at a meeting yesterday with a wide variety of patient advocacy organizations. And there seems to be a disconnect, and maybe you can comment on this, a disconnect between some of the patient groups who favor the Inflation Reduction Act, partly because it covers vaccines or covers some vaccines. They like it, or some patient groups like the IRA, but it seems the biopharma business community is beginning to push back and looking for changes. Why the disconnect between the patient groups and essentially the biopharma companies?
Sure. Well, obviously, the IRA, the Inflation Reduction Act, is an enormous piece of legislation. It's got lots of things in it, and it's got lots of things in it that I think are good, like capping and smoothing payments for people on Medicare, incredibly important. But the piece that allows the government to set prices, is extremely dangerous, because price controls equal choice controls, and it's true anywhere in the world where this happens. Europe, Canada, you pick. When the government sets the prices, the government limits choices for patients, full stop. And nobody's for that, and certainly not patient groups. The patient groups who say, why are we attacking the president, quite frankly, in my mind, are speaking out of other parts of their bodies other than their mouths, because they're trying to placate politically the man in the White House. And I understand that. I also live in the real world. But when something as dangerous as supporting government price controls comes on the table, you have to call it for what it is, which is incredibly dangerous, fully anti-patient, hugely anti-innovation, with enormous consequences. And I'm not going to say unintended consequences, because we know what those consequences are. And you look at any type of scoring of those codicils of the IRA, and they're all completely on beam with each other. It's parallel. Everybody from the Congressional Budget Office on down says, if this legislation goes forward with these pieces in it, we are going to have fewer innovative drugs, full stop, and a whole lot more than the White House is saying. There's also a degree of dishonesty. I go back to the copay question. The president says this is going to lower drug prices for Americans. Well, not for the 92% of Americans who have health care insurance. Their copays aren't going to be impacted by a penny. And in fact, because of the weird math of American healthcare, copays might actually go up. And the ability to get new products or even generic products at lower prices is going to be completely skewed. So, there's a lack of honesty. And, if we don't pull together and be honest with each other, all we're going to do is start exchanging talking points, and the best lobbyist wins.
Peter Pitts, that's part of the reason why we started this broadcast. I mean, I do other media. I have a talk radio show, and I'm the editor at Real Clear Health and Real Clear Policy. But I want to underline and highlight what you're saying about and having an honest conversation. We could be spirited but remain civil, but it does seem around healthcare and the business of healthcare, it's almost entirely political. But let me ask you this: the public discourse on this, there are those who kind of know where they want to go, whether it's Medicare for all, or if it's some kind of public option, or expanding on the Obamacare legislation, the Affordable Care Act. But the other side, so to speak, the GOP side, do they have a coherent idea about where to go in terms of healthcare policy, in terms of allowing this business sector to continue to thrive? What's your thoughts on that?
If you had asked me that question 8 months ago, I would have said that the Republicans have no savvy alternatives. But things have changed. And now there's serious legislation that I hope will get passed because I think good things would happen if it got passed relative to things like pharmacy benefit managers. The middleman in healthcare that nobody really wants to talk about for lots of reasons, not the least of which is they give a lot of money to members of Congress on the D side, not to call it out too sharply. You have a invisible middleman that is sucking literally hundreds of billions of dollars out of the healthcare industry that goes straight to their bottom line. And no one wants to talk about it. A couple of years ago, Senator Romney said, well, why don't we just do away with the middleman and pass these savings along to the consumer? And the PBM industry said, well, Senator, you don't really understand. It's more complicated than that. And you know what? It's not. And when the Senate called a panel of pharma executives to testify, they all said that if the PBMs were zeroed out of the equation, they would lower prices. And they all raised their hands when somebody on the panel asked if that was true. So now there's legislation, and I'm hopeful that it passes, because once it does, once the veil of secrecy is removed from this unknown middleman that's sucking billions of dollars out of patients' pockets, all of a sudden we can recalibrate what healthcare costs really looks like. So I'm optimistic, and this has been driven by the GOP, quite frankly. I think that many members of Congress on the other side are accepting too much money from this industry. Lobbyists have been able to point the fingers at big pharma for years. Big pharma, as you said earlier, is generally seen as the boogeyman. I don't believe in fixing the blame. I believe in fixing the problem. And I think that focusing on the entire ecosystem really is the proper path to get that done.
One thing I've been for better or for worse, I've been in DC now for 20 years. And it seems to me, everyone talks about, well, in the old days, it worked better. I'm not sure if it worked better or worse, but I will say this. When Congress acted in regular order, when there were appropriation bills instead of omnibus bills, when committee chairmen had more authority and more power, when committees actually worked out legislation, in terms of the healthcare sector, we've had bipartisan reform in the past that has benefited. Regardless of your political persuasion, it helped you in terms of access to care and affordability and all the things we're talking about, innovation, science. Do you have any hope that moving forward, maybe after the presidential election of 2024, I know that this new speaker, Mike Johnson, is talking about returning to regular order and the 12 appropriation bills. But I'm going to ask you this. I'm a despairing optimist. I'm a realist, but I have hope, right? I just recently saw something somewhere. I was rewatching The Hunger Games, and President Snow in The Hunger Games says that fear is good. You can govern with fear, except if there's hope. Hope is stronger than fear. So I'm going to ask you this. I'm a despairing optimist when it comes to we can get things right. But do you think in the near future we're going to see Congress return to regular order and actually pass legislation that allows, again, this innovative American business sector to thrive? What are the chances of some kind of new normalcy? How's that? New normalcy.
Sure. Well, I have a new book out. It's called The Next Normal. It's not about returning to the way things were. It's about moving forward to what's next.
Do you see how I set that up for you?
Well, welcome to Washington. But I think the answer to your question is hope springs eternal, and I'm certainly hopeful. And just looking at this stuff chronologically, you had amazing pieces of legislation, bipartisan legislation that have really evolved and moved healthcare forward. You had Hatch-Waxman, you had the Orphan Drug Act. More recently, you had 21st Century Cures. These are all bipartisan pieces of legislation that had an enormous impact on healthcare in this country. So am I optimistic that we can move forward? I absolutely am. And that the fact that the speaker is actually talking about that, he actually has said those words, is amazing. Healthcare should not be political. I know that sounds a little bit naive, but rather than looking for simple solutions to complex problems, we really need legislators to understand that it's going to be hard, it's going to take a long time, it's going to have to be thoughtful, and it absolutely must be bipartisan, and that the voice of the patient needs to be taken into serious consideration here.
No, you're right. I remember years ago when 2007, when the Democrats took control of the House and Nancy Pelosi became Speaker, there was a big meeting up on Capitol Hill in the Speaker's office, and all the patient groups were invited in. And at the time, I was working very closely with the patient community, and I remember remember the old BlackBerries? Someone was instant messaging me about the meeting, and one of the patient groups now, said, why isn't pharma, the pharmaceutical companies in this meeting? Because if we're going to talk about access and prices and costs and moving forward, it should be a broad conversation with everyone at the table. And I thought to myself, this is how we should be thinking. Everyone should be around this table, and we're not all going to get the whole loaf. But if we can get a slice and a slice and a slice, we might end up with a better healthcare system or systems. Like we don't have a single system. We have Medicaid, Medicare. We have TRICARE. We have the Veterans Care. We have private the private market. We have county systems and state systems. But I think that if everyone's around the table, we can come to some policy answers. But let me ask you this, because you're right, this is complicated. And folks don't realize, I hear a lot, and you hear this too, right? Oh, those CEOs make so much money. Oh, they're multimillionaires, and look at these companies making $1 billion. How much money, Peter, does it take to take a drug from the laboratory to the market?
Now, this is not a guesstimate. There's solid economic science behind this. And Tufts University does a regular study that answers this question, and it's about $2.2 billion, that's billion with a B, to get a drug approved through the FDA. Now, that also includes the hundreds of billions of dollars that drug companies invest in products that fail, that never even get to the FDA. And then on top of that, you've got the products that get to the FDA that don't get approved by the FDA. And after all that, you're left with various products, only about which I believe 25% of the drugs that get approved through the FDA actually end up turning a profit. This is a high risk proposition when people say, well, these drugs, they make billions of dollars, and that's true. But you also have to factor in all the drugs that fail, that dwarf the profits. Also, when you look at kind of big pharma stock prices, and I don't own any healthcare stocks, I never have, and I never will. They are not top performers, not by a long shot. And when you look at, I don't want to name names, but any big drug company's stock price, believe me, it's not on anybody's recommended list. And you have blips like, COVID vaccines, but those blips, they come and they go, and drugs go off patent and they get picked up on the generic market. It's not. If I were investing the mortgage, that's not what I would be purchasing. But again, it's convenient to blame big pharma. You have to look at the whole picture. And when you talk about patient groups being invited to the White House, that's great. It's nice. It's a nice photo op. But a lot of times when you see who from the government was sitting in on those meetings, it wasn't anybody, quite frankly, Jerry, that's smarter than you. And I believe that people who understand the dynamics of what's happening need to be at the table for these meetings.
No, absolutely. Let me ask you this, because we've talked now about big pharma and the pharmaceutical sector. I have, and on this podcast, we've talked to individuals who have essentially these startup bio firms, and the resources, they go out and they raise money from sometimes from their friends, but also from investors and that sort of thing. It's not just these big blockbuster medicines, but there are all these little pharmas, so to speak, that are struggling to get the resources to get through the FDA process and to do the science. What is the business environment for little pharma?
That is a really great question. As we were talking about earlier, when you pass pieces of legislation like IRA for price controls, or the president says we want to march in on people's intellectual property, the message that it sends to the investment capital community is don't invest in startup companies. You're only asking for trouble, because even if these drugs get approved, the government's going to take our intellectual property. So, what we, especially in these days, when we're talking about Alzheimer's disease and gene therapies and CRISPR technologies, And the message is, wow, this is a high risk proposition, and the government is going to make it even less likely for you to make your money back, invest someplace else. That is just adding serious hurt to patients that have the need for greater hope. And it also says to scientists, do something else. Don't do pharmaceuticals. Take your brains and go someplace else. You'll only lose money here. So if the U.S. government is sending the message that there's no value to intellectual property, that there's limited protection for patents, people are going to vote with their feet, quite frankly, and all these new, very promising technologies are going to go absolutely nowhere. And that, quite frankly, and this is not hyperbole, is a death sentence for a lot of people. And when you look at things like Alzheimer's disease, if we don't seriously invest and we don't allow small company thinkers to develop and evolve their technologies, economically, it's going to bury us, and it is going to be our own fault.
You're right. And again, the conversation often lends itself too much to kind of the big pharmas and this sort of thing. Let me ask you this. This is going to be the most controversial or provocative question. We believe in science. You and I have, and I know you long enough, we have great respect for the gold standard at the FDA and the great work that the NIH does and HHS. Eric Hargan's a friend of mine. He was the interim secretary at HHS and was a deputy secretary there. So we have friends who have gone in and out of the public health community. We know the great work that these public health agencies do. But COVID has resulted, the pandemic and our response to the pandemic has left many Americans very distrustful of the public health community. And I'm someone who understands the importance of compliance with vaccines, especially for children and for older Americans. We're in this respiratory illness season right now. Peter, I just got over pneumonia, and thank God for pharmaceuticals and antibiotics. I was on my back for 13 days and couldn't breathe. So my point is that what do we do without vaccines and antibiotics and the medicines necessary to deal with these issues? You've seen all the numbers I see. Compliance is down for even youth and infant vaccinations. Older Americans aren't getting vaccinated for respiratory illnesses, and the COVID. I think the COVID vaccines. I'm not sure what the numbers are, but they are down. How does the public health community get back to this is about the science, not about the politics?
Well, when you have to give people permission to rethink their position. And, one of the serious issues when it came to COVID is that the government was very quick to point fingers at misinformation and disinformation, and rightly so. But what they needed to say was, hey, we've made some serious mistakes on the communications front ourselves, and when you want to correct ourselves and when you want to apologize, and when you apologize, you can move on. But when you don't, you can't. And I'll give you two good examples. So President Biden at one point said that if you get vaccinated against COVID, you'll never get COVID. And of course, that's completely untrue. And then the White House had to explain what the president actually meant was this. But the damage was done. And people said, well, if the president doesn't know what he's talking about, why should I even pay attention? July 4th, 2020, the first summer of the vaccine, there was a 4th of July celebration in Barnstable, Massachusetts, where almost everybody there was vaccinated, and 700 people came down with COVID. And the storyline was breakthrough infections. Remember that? Breakthrough infections? Yes. Rather than, oh my God, these vaccines work. Nobody died. It was just a complete, a muck up by federal public health communicators as to controlling the message. Pointing the fingers doesn't get the job done. Correcting the mistakes, admitting when you make mistakes was huge. Dr. Fauci, a bright guy, a public health hero, made a lot of mistakes. I never heard one word of apology or correction out of his mouth. And that's got to change. If we want people to do the right thing, we have to accept that the government made process fouls. There were self-inflicted wounds, and say science evolves. We're all learning at the same time, and move forward. I think that when you do that, people believe you, they trust you. People want to believe the FDA. People want to believe the CDC. People want to believe the president. But we have to admit when we've made mistakes.
hope is stronger than fear, and I think that's true here. You know, my mantra with my kids is if you mess up, fess up, forgive, move on, right?
Right, and trust is huge, because if you don't have trust, you can't speak science.
Yeah, but I agree with you. The American people want to trust our public health community. Look, we have heroes. You said the word. We have heroes working in public health, in the private systems. And I want to leave on a positive, leave our conversation on a positive note. I've seen two hugely successful public-private healthcare reforms in the last 20 years or so. The first big reform was the Medicare Modernization Act, 2003, where you saw private sector, public sector create a drug benefit in Medicare. Think about that for a second. We had a health insurance program for seniors without a drug benefit. And both the left and the right came together, right? Senator Kennedy and the Bush administration, and then you had the companies working with the public health community. It truly was public-private reform, and it's worked. And I mean, unless you're being political, everyone agrees it's worked. It's been a huge success. Now they're messing with it in terms of wanting to strike some parts of it that protect the competitive nature of it. But regardless, it was a great success. I also think Operation Warp Speed, how again the private sector, the public sector work together to get a vaccine to market. Look, it takes 10 years, Peter, to get a drug to market, or roughly 10 years. The vaccine was to market in around 10 months. That is, so in the future, are we going to see more public-private partnerships in healthcare reform?
Well, one of my proudest moments in government was working on the Part D benefit.
Yeah.
And I was there when the president signed the bill. I helped make that happen, and I'm incredibly proud of that. When the government and private industry works together, we can accomplish amazing things. Operation Warp Speed would never have happened without that partnership. All the other issues notwithstanding. Europe doesn't do that. They believe government can do it all. That's our leg up. And not only can we make a lot of money doing that, and that's okay, we're going to save and improve hundreds of millions of lives. And if we don't keep our eye on the prize, shame on us, because we know what the answer is, and it's being in it together.
Peter Pitts, CMPI, my good friend, an expert and honest actor and wise voice. We're going to do more of these, because this conversation was too short. And frankly, one of the best conversations we've had on the business of America. I hope you'll join us again, and we'll see you soon.
My pleasure. As always, Jerry, thanks so much.
This has been the Federal Newswire's Business of America podcast, hosted by Jerry Rogers. Check out the Federal Newswire's family of websites, as well as their social media stream,